Welcome back to the Hope Show. My name is Julie Gordon, and today I have with me Nicole.
Hello.
Dr. Momi.
Hi.
And Casey's back.
Hi.
Today we are going to be talking about the parent component in ABA. And in our past podcasts, we have been focused on reform, ABA reform, and how we can just do things better, take best practices and do best practices better. So today with the parent component, we're going to be talking about just different ways, maybe historically, or how parent training is currently done. And maybe if you're a parent of a child with autism or a child in ABA, you might be kind of reflecting on how you receive parent training, whether that's been a really successful and empowering experience for you, or whether you kind of leave those experiences defeated or lost or just really not helpful. So we're going to kind of talk about different ways that it can be done, should be done, and from our opinion. But without further ado, okay. So what is the purpose of parent training? So it could be called parent consultation. It could be called parent training, family guidance, family therapy, kind of really depending on who you are as a clinician and your scope of practice. So we're going to actually be talking about all of them because we have such a diverse team where we can do a lot of those different things. So the goal really is not just about, insurance is requiring. That's kind of a new thing that we're hearing all the time. Insurance, this is mandatory because insurance says we have to do it in order for ABA to be approved. While that may be true and it's important, but I do believe that the funders do recognize that outcomes are better when the family is really, really involved and the family is supported and there's that carryover. So that is a big component to it. But we really believe at the Hope Source that that the family is the client as well. And if the whole family, if their quality of life and their overall well-being is not improving, then we're not doing our job. Even if the client, the child or the adolescent or the young adult with autism is improving, if the family's not, then we're failing. So that's something that may be a different way to look at it. But we're really passionate about that because that's really essentially how the Hope Source started. So when I got into the field, when I was just a behavior technician in the homes, I was in grad school to become a social worker and to be a therapist. And what I had saw was we were making, decent progress or really great progress, with the child, doing their therapy programs and things like that. But as I looked around me with the lens of a social worker, who looks like our forte is family systems, right? And so when I looked at the family, I saw siblings, depressed. I saw siblings isolated. I saw, fathers feeling rejected. I saw the mother just running around stressed out, living their lives around autism. And it was like, what is happening to the family? And we look at the divorce rates with special needs, all of those things. And I said, kind of, what are we doing? So my goal when I actually started the Hope Source, I just planned on being, just being a counselor, doing parent-based intervention. I just wanted to kind of really counsel the families, and help them to support and kind of just live life normally, whatever that means. I don't even know what normal is, but whatever that means to them, really. And so I wanted, to do that. And of course it, took a life of its own, and the Hope Source is what it is now. But getting to the heart of what it was designed to do is making sure that that's a huge component in what we're doing. So that's why we really strongly believe that. Now, you can do, family guidance without having your child in intensive ABA as well, which we're going to talk about. But, I think that we hope that you can see that why we believe it to be so effective when it's done really, really well. with the family in mind. So that's a little bit of our history. So when we talk about, like I said at the beginning, a lot of people call it, different providers call the parent-based component something different. So you probably have heard parent consultation, parent training, and other things. So we're going to just talk about them specifically and more of describing the session and what that looks like. So I'm going to start off with what we're going to call parent consultation. And those sessions would be something where, your child might be in intensive ABA and you meet with the BCBA once a month just to learn about goals, their progress in therapy. Maybe you might have input in those goals. But that's what we're going to talk about first, is really just that session to where it's just very, very few over the course of therapy. And its purpose is really just to give the parents information. So I want to talk about that first because, Nicole, you have a lot of experience in ABA and a lot of experience doing parent consultation and those types of sessions. Can you kind of talk to me about just your experience with that?
Yes. So with the parent consultation I've experienced in the past is exactly how you explained it. So usually it would be, hey, here are the data, here are the charts, here is what we're doing really well. And when I say here, as a clinic or as a provider, and those have good points. But as you said, it actually does not give the parents information on what they can do and how they can generalize those skills that we're building center-based at home. Yeah. And so what happens is a lot of times that parents are like, oh, that's great, but we don't see that. Mm-hmm. And there are various reasons of why some of the stuff that you explained, and I feel like I learned that later working here. But for the most part, at that time, it was more so let's kind of just check off a chart. Okay. Right? So check off progress. Okay, we can do this 2 times, we can do this 3 times, but not really in a natural way or able to have that happen in a natural environment. And then I think that was what becomes problematic because then it becomes more of a performance instead of a skill that you use.
Yeah, yeah, that's great. I was thinking about the aspect of, where the family input and understanding as we're having all of these goals, like these goals are great. It's not a marketing pitch of how well we're doing. And I think it can get like that sometimes. It's like, I want to convince you that we're doing a really great job. And we should show that. That's our role. You're entrusting your child into our lives. We want to show you that we're doing what we say that we're doing. But understanding where that input comes into play. If you're not seeing what's happening or understanding what's happening in the home environment, those goals, I mean, how, the thinking about how much we change the goals or how much we look at, behavior or, what's going on in the child's life is really kind of, we have to take those factors in mind. And I think a consultation is more just giving information as opposed to receiving information.
Yeah, so I totally agree.
Yeah. And I think, the generalization problem in ABA, I guess, is always really talked about and how much needs to be carried over. And I think that, understanding if I just give you the, give you the data or it might be like, okay, here's this information. They're not being empowered with the information. It's just, here you go. Here's the data. Well, that's really great. But now I'm left. What am I going to do about it? And so understanding what that input is. And I think one of the big implications, Dr. Momi, is the idea that when you do that, we start to separate the family from the therapy. And that gives this impression that the therapists are experts. So when I say therapists, that's the olden day. So the technicians or the clinicians, the behavior analysts that, oh, you guys are, you know what you're doing. You're the experts. Okay. And I don't know how many times we've heard that, in whether that families coming in for intake, but understanding like what happens and that kind of cycle of defeat, because we are not the experts at all. You are the expert of your child. As a parent, you're the best person. I always used to say you're the best person for the job, not me. And so I think that when we start to say, here's this information, here's how well we're doing, we're really shooting the family in the foot. I don't know if you could say that. That's not a really good metaphor. But in the sense of, we're setting them up for failure because they start to believe that. And I think a lot of times we've had families come in that we've had to, really help therapeutically for them to kind of undo that feeling, especially just kind of years of having parent consultation, that no, how do I show you or convince you that you are adequate, more than adequate, and that we don't hold a candle to what outcomes could come from you being confident in your relationship with your child. So
I think that may be the reason why sometimes the participation in family guidance training, those have to be low. Sometimes because if you feel defeated, it's kind of scary to go in and you don't want to feel bad.
Yes.
And some of the data sharing graphs, that can be overwhelming.
Yes.
And you feel like, okay, you are in a good hand. My kids are well treated, making progress, so I'm not part in that.
Yeah.
And I think that may be what we are communicating.
But I also think that makes me think of, how they must feel when they're getting, especially if the chart looks good, because we're selling, right? We're selling our services. But when the chart looks really good and home does not look like that. And so it's kind of like, well, he does really well for you. And while you want as a parent to say, okay, well, they're doing well, so this is not harmful, or, of course, there's good things happening in their day, at least they're in a place where they're making progress. But that feeling of look how good we're doing, and we're making all these progress. But again, going back to what I said in the beginning, if they're not making progress at home, what are we doing?
Right.
Because the family, that's who's going to be there in the end. That's who's always going to be there for the rest of their lives. We are a blip in their lives, an important one. I'm not going to, negate that, but understanding that if the family is not the primary focus, and setting them up to when we're done with services, that they're ready and they're confident. So I think that's, really, really critical aspect. So kind of going into the next, what we're going to call parent training. Okay. In the contrast between what we're calling parent consultation and what we're calling parent training, again, you may call it the same thing, is kind of upping it up a little bit, taking up a notch. So this might be where we put a BAP into place. The parents might be trained in whatever program they're doing in ABA. It might be that they're either the primary person. They could be doing a parent-based intervention where they're the primary person. But the whole goal would be that it's a carryover from clinic to the home. Okay, so you do what we're doing. Okay. So with those experiences, everyone's different experiences at different places. What have you found that, while that's really helpful, but what is kind of the main thing that creates a block, or can potentially disempower families?
Yeah, I think from my experience, oftentimes parent training will turn into focusing more on maladaptive behavior. Like that becomes the main focus, which makes sense. That's the loudest thing that's happening. And it can be scary. It can be concerning and things like that. But that's where that gets focused on, and not so much of like positive behavior and things like that, which is a concern.
how to reconnect the
Yes.
family relationships.
Yes.
And I think that's, there's a difference between, I'm presenting there's safety issues. And that to me it needs to be separated when we think about how do we, that might need to be in place kind of as a Band-Aid.
Yeah.
But also that we need to focus on long term, the family having the skills, the family having the relationship. Really, that's what it's about. It's about a parent-child relationship and getting that strengthened so that, those maladaptive behaviors would decrease on their own from that skill acquisition. So I think about giving, that handing over of the BIP here, no matter what. Yes, you're in crisis. And so I'm going to write a BIP to decrease that crisis. But I think about, Dr. Momi, about kind of parent readiness for that.
So sometimes we may have a wonderful plan, but the parents may not be ready to implement. If your stress is high, you are in crisis, marriage, whatever that is going on in a household, if they're not ready, it's just another thing that they feel bad about. Then we are kind of losing the parents, losing the family to engage in our therapy as a partnership. So we need to be able to kind of see where they are and then what they can do at that moment. And sometimes we need to put things on hold and kind of individualize the plan so that they can succeed.
I think a BA came to me one time and said, like, it was the first time that I had a parent meeting when I put my notebook aside or whatever and just said, how are you doing? Because obviously the parent was not doing well. It was all over their face, hanging on by a thread. And it was freeing for that behavior analyst to say, like, at other providers and other places, we had to do this and this is what it was. But here, the freeing aspect of being able to say, like, how are you right now? Here's my agenda out the window. How can I help right now? What is going on? Talk to me.
Yeah.
You probably have that experience all the time.
Yeah, I definitely agree. And, I have to speak for myself, but I think other BCBAs may be able to relate that it is drilled into you and in the moment your BCBA you could probably relate to, is drilled ethics and staying within your scope and to, stay in alignment with that. But it still doesn't tell us not to be human, not to have those shared experience with another human being. And that sometimes get lost in the family training. Basically because we have a different environment. If you are training parents or guardianships, whomever, right, in that role, they're not in a center one-on-one all the time. You have to take the other dynamics into play. You may have multiple children. You may have multiple children who have autism. You may have just different dynamics, single parents that can be mother or father. You just have so many different things that make a difference than if we're in the center. So it really isn't fair when you really think about it to say, here's a BIP, unless you wrote one just for the home. And even in the home, it's still parents who work daily, and if they don't work and are homemakers that still work, it's not fair. And so I think we kind of talked before about we kind of let parents off the hook in that case to not have to do this detailed BIP. We will cater, and like you said, if it's crisis, we do want to put that fire out. That is important. We would never say that that's not, but I think that's part of that in the family guidance that's not in parent training, like you said, to be able to discriminate, like when is that the right time. Right.
And I think when we've been talking about BIPs, but even skill acquisition, I'm going to train you in your programs. And at that point there is, which is, might be necessary to work on skill acquisition and carryover. I'm not saying those, we're going to talk about that in a little bit, but when it gets to the problem starts to happen is when the family feels like they become the therapist. Yes. No, you are the mother. You are the grandmother. You are not the therapist. And nor should you be. It doesn't mean you can't be therapeutic with your child. Sure. But kind of taking that, what you always say.
Yeah. Just like taking the pressure off. I think that families carry so much pressure on themselves of like, I have to be their teacher, I have to be their tutor at home, I have to be their therapist at home, we have to keep this going. And just saying, no, you don't. You can just be their mom, or their dad, or their grandma, or their caregiver,
or their sister or brother.
Yes.
I mean, the siblings too. And I think that's when we talk about parent, or parent and caregiver, those types of things. But there could be a whole other dynamic of like, how do you be a brother or sister? And we don't want them to be little therapists. I remember saying that all the time, and I'm like, no, you're not the little therapist. I mean, you're gonna have like the firstborn is always gonna do that, no matter what, or what family you're in. But helping them to take the pressure off the siblings too. I've seen that even. And so it's being aware and cognizant of all of those things and those dynamics that are happening, and the bias that you might have as a clinician of what should be done, or like all of that has to be just, you really have to think ethically and applying and pulling yourself back, as a clinician. And it's not even about putting yourself in their shoes. That has nothing really to do with it. It's more of just like, I'm meeting you right here where you are, and we're going to go through this together. So how we do it. So the next one is family guidance. So that is what we call the parent component in ABA at the Hope Source and at Heart SOS. And understanding that we call it family guidance because that is what it is. I'm not training you. I'm not just merely consulting. The goal is with family guidance is I am guiding you to guide your child, to guide the rest of your family, or whatever that may be. Okay. And what does that mean? Okay. So it's not, we all are here for each other, and having that support and what levels of support needed for your overall well-being, your overall quality of life. And so, when we kind of get into that aspect of, understanding autism, understanding what this behavior is communicating, and understanding with your particular child, because sometimes it's very obvious, like you said, the behaviors can be really loud, but sometimes they're not at all. If you have those more mildly impacted, it might feel like oppositional. It might feel like lazy. It might feel like that. And, and the parent's reaction when we start to talk about those areas that actually, if you don't, if you're not being able to read nonverbal, they're going to miss this huge aspect. And so this is what we're seeing is happening when you guys have an interaction. And those little tiny things that can be just little simple things to change, little tiny things, change into a lifestyle for the family that isn't them implementing skill acquisition goals, so I mean that's kind of our job, but they can carry over in a way. And I think that was the biggest thing in ABA that we're told in the field is that you have to teach it, they have to teach it rotely, we have to teach it rotely, but guess what, that's just not true. If they just slowing down, we all need to slow down, all of us. And just slowing down, when we think about behavioral cusps, we see that. How can I just slow down as a parent? How can I, even if I just show you, actually, this is what you're seeing. This is a result of this. And just that change in framework and looking at it from a different lens, all of a sudden, the family just takes off, and they don't do anything other than looking at it differently. It's actually one of the most beautiful things. So, the parent aspect is my favorite, obviously, but I wish parents and caregivers, and clinicians in this field understood the power of the healthy family, and, and how much, can be how much they can reach their goals faster, and just relax. So with that family, our goal with family guidance is restoring those family relationships, and in that parent-child relationship, and helping them to just have kind of this just a healthy daily life, really. So what is one of kind of the things that you find that you've really enjoyed now that you've kind of taken this role, and that's what you're doing full time, is family guidance and guiding these families? What has been like your just kind of like favorite or an aha moment or something like that?
I think honestly, it's overall so far in my career the most rewarding.
Okay.
I still also love working directly with children and young adults and those who are transitioning into adulthood. But I think this has been the most rewarding because you get a bigger picture. So you get so much information of from parents and their just journey to the point wherever they are here. And that could be littles, middles, and bigs for our center. And a little bit scary because, it's like, wow, thank you for trusting to share this information with me. Thank you for giving me a different perspective. No matter how many parents, how many families that I feel like I've seen thus far, I still get a different perspective, different understanding, a better understanding from that parent. And I think that's important, why we should remember that we do individualized treatment programs. We do for each client, each kiddo, each family, because that may look different from family to family. Even if you have a family with mom, dad, 2 kids, it still could look different from household to household. And so I think that's been the most takeaway. The training component from the center-wise has been pretty eye-opening, and that aspect of aha moments of prior when I work with kid, oh wow, that's probably why that made sense. Oh yeah, that makes more sense. And I think we touched about it a little bit, but to expand on, like, we have a unit, like we have a kind of one-stop shop, as I like to talk about. And so I can just get on and message Momi, I can message Casey, I can message people in OT, I can message you, I can message different people who that is their scope if I feel like, oh, this may not be for me. And I feel comfortable telling the family and saying, hey, thank you for sharing that. Do you mind me, reaching out to this person, because I think they could better help you. And I think that's what makes our model a great model, seriously, because you don't have to travel here, there, and another place, because you're already kind of exhausted from just being a parent and doing the things you're doing. So you have all of that here at your disposal, and we have that to communicate as clinicians, and I think everyone could benefit from that. Yeah.
So going off of that, in terms of the feeling like the moment where you were like, oh, I can do this. I thought that I wasn't able to do this. And that fear from, you being in a unique position to be a clinical psychologist and to be CBA is to, how do we have your scope, right? And I'm only talking about behavior analysts because in ABA, that is who's doing the parent training, right? So mainly. And so understanding that, like, while it's in your scope, to do certain things, there is this competence building and pushing and not fearing kind of that mental health side of things. And I think that's, which we've already talked about, mental health, and we're going to talk more about mental health in ABA, but that piece of it.
Yeah, and I feel like a field is rapidly changing in that regard. People talk more about the psychology side and mental health issues. So I think we are in a kind of getting to the good place for that, and family guidance is kind of where that we can kind of bring all the aspects in it. And I think that you said fear, but this is your field, this is your scope, and need to be able to see that the cultural humility we talk about, you need to be able to bring all the data, and then you kind of realize your biases about what kind of assumption we have, and these kind of meetings kind of help you to learn about where they are coming from and all the aspects. And that would help us to come up with the individualized plan for each client.
And I think making sure and getting that information, if we're not getting and understanding that, we could easily put into a plan in place that, you know, whether culturally or just fundamentally, that's kind of against their, you know, I believe that this should be done with my client, or my child. Or this is not what our family does.
Correct.
And that's when it starts to get in easily. And I have seen to where it'd be like, well, but this is what we're doing. This is what's effective. When it's just not going to be effective because they're not going to do it. And nor should they. It's actually would be unethical for you to kind of push that, you know, and I think so just understanding a little bit more, and there might be an education piece, and they might have an aha moment where like, oh, I didn't think of it like that. And that's where that rapport and why the therapeutic relationship with the family is so important. The family is not a customer. The family is a client, and they should be treated with that kind of respect and that ethical, but even like trauma informed, because the big thing with trauma informed ABA, and we talk about it, we do it really well. But this component to me is just as important, if not more important, to have trauma-informed approach to family and parent training, because there could be grieving happening depending on when they got their and maybe even they could have their diagnosis 20 years ago and still be grieving. You know, understanding that what I used to see a lot is a lot of times, you know, dads or grandfathers feeling rejected, you know, from their child or grandchild, and how do I navigate that and kind of swallowing that? Well, that takes its toll on the body, that takes its toll on the whole family dynamic, and so understanding those aspects of it, and understand that they have been through trauma, and we have to heal. We have to heal the whole family, and whether that be on an individual basis, on a family basis, in light of the client. And I think that, you know, that's just so important. Otherwise, we're not going. It's just not going to happen. Like it's the outcomes that are supposed to come from that aren't going to be had. And so thinking about mental health. Okay, so we have this scope. Right. Okay. And, you know, we have the extra scope, I guess, of being able to be, you know, counselors and therapists. And so when we do parent training, we have a little bit extra that we're allowed to do, because we know we're licensed to do so. Right. So thinking about, you know, when a family is in crisis and when you recognize, okay, this is out of my competence. So I need to consult, and now this is out of my scope. And that kind of brings to the fourth thing, which is family therapy. And I think we're doing better in the field. But if wherever you are, you're not, and is understanding at what point do I refer? And we cannot do everything in ABA, nor should we do everything in ABA. There's really great people, biased, that are that can help support the family in the mental health. And so knowing when it's time to refer, and knowing when, wait a minute, this family isn't going to benefit even from family guidance, because they're in a state of deep depression, or, you know, anxiety, or they're in the middle of a divorce, or whatever that may be. And, you know, so the next thing is, when do we refer to family therapy? And what kind of things can they gain from that? So I don't know, do you want to talk about those types of things? So what that line of family guidance versus family therapy?
Kind of hard to say that line there.
Yes.
But what I can say about is we consult and then kind of see where they are and figure out, are they at the place that they can learn, they can function to participate? And if it's not, then we gotta look at what's the source of the stress, and then you gotta address that. Kind of oftentimes, medical doctor, we gotta rule out other things. Kind of same thing. It's just mental health issues that we need to either address first or concurrently, and they will come up with a plan for the family. And of course, that's kind of working together And oftentimes we do a better job because of the trust that we have in a family consultation, that when you recommend, they get it and they trust you and they follow through with the recommendation.
Yeah, I agree. I feel like you said, what time, like when do you know? I don't know if there is an exact time for everyone.
No, of course not.
I do think sometimes as a BCBA, you still have to walk a fine line, not to insult anyone, to make them feel that you have judged that, oh, you need mental health. So I think it's good that we let people know that, hey, this is a service that is available. Yeah. And the reason that we would do it is actually to help and to guide you to the right person that can help. Like, I want to help you, not saying that I'm not going to help you as a BCBA, like you said, within my field, within my scope, but for some of these, issues that are going on right now, and it could just be a right now thing. It doesn't have to be a forever thing. It could be something that comes up. Then, hey, you might want to talk to this person. And I think we do really well at not pushing our services. We may say, okay, if you don't want our services in that situation, there may be someone else who can do that. Just so people know that, like, we're here as a service to say what is right for you. Whereas, and I think you touched up on that a little bit, Julie, there is some pressure when you're your BCBA clinic or ABA clinic with just BCBAs to do everything because you're providing a service to the family. But like you said, the truth is everything cannot be solved that way. And that's okay. I think we should start that conversation, right? Yeah. As part of the reform, as part of the change, to say it's okay to say that, yes, we do this very well. And this, someone else does very well. Yeah, right. And as a collective, it comes out as a great thing.
Yeah, and I think challenge, we've always, where I did a lot of the parent training and you did a lot of the parent training, and even Casey as a speech pathologist, understanding that is all within our scopes, but having and challenging ABA providers to think about having a social worker or someone else who is skilled to actually do parent trainings, not parent trainings, family guidance, and family therapy, or whatever that looks like. And it might be something that's as a need basis. So it wouldn't be necessarily every client. And we kind of look at it like that too. Like if they just need parent consultation or they just need parent training, this person would be best. But if they're coming in a state of crisis or things like that, then maybe it's best to have one of our social workers be that first person in family guidance, because they have to get to a good place of where, this is really what it's about. And I think that what we're trying to do with the purpose of this podcast is help to see, even if you've had experiences where, okay, this is what I'm getting, I'm not really getting very much from it, I'm defeated, I feel like a failure, this is a waste of my time, oh, this is just because insurance is making us, understanding it doesn't have to be that way, and that we need to do better as ABA providers, and meeting those needs of the family and thinking of them as, the parent and caregivers and the whole family unit as the clients, and having that really that safe place to have more trauma-informed care for the family. And so I think that to understanding kind of what you're getting and what you need, and that's the challenge that I have today. And we thank you for listening.